One thing that men has realized with this HD effect, where they're seeing themselves in high definition, they notice that their skin is not what it used to be, there are tiny veins developing, there's pigmentation developing from the years of chronic sun exposure without sunblock every morning. It's not a thing a man does, so it's very important that we educate our male patients that if you only have to do 2 things a day, number 1 is to put your SPF on in the morning, and at night wash your face, get all that SPF off, and then put a multifunctional topical which contains retinoids and brightening compounds to help the aging process, to help the glycation in the skin, which is when your skin becomes gummed up and brittle from all the sugar that we've eaten and the high glycemic index food that you've eaten over the years. And we also need to treat the inflammation in the skin, and we need to treat the oxidation in the skin. And that's why it's so important to get a multifunctional topical that will do 5, 6, 7 different things in one smear of a face cream at night. So that is where you need to come into a trained aesthetic doctor who will explain to you exactly what's happening to your skin and how we can correct it, starting off with a good skincare regime, and then if necessary 1 or 2 treatments to remove the pigmentation of your face and maybe even remove a little bit of sun damage and remove those tiny veins that are showing up. And unfortunately, men cannot hide things like women can do with makeup. So this is, what you see is what you get. So it's very important to have that blank canvas and to have a healthy looking canvas so that you feel better in your own skin. So one thing that really bothers men is that look of exhaustion on their face, and they're not quite sure what's causing it. So what happens as you get older, the muscle around your eye, that little round muscle that's a purse string, becomes weaker. And you have a ligament called the orbital retaining ligament, the name says it all, that keeps everything in place. So as you get older, this orbital retaining ligament gets weaker. And then you also have this muscle that starts weakening, and it starts attenuating, and it starts, instead of being a round muscle, it starts becoming a large oval muscle, and it drags the skin down with it. So we have to start rectifying that, and obviously that prevention is better than cure. So you don't leave it till the last minute. 80% of the time you should have a treatment to make sure that this doesn't happen. So what we do is put a bit of dermal filler in a very strategic point. We actually have to mark it off on the face because that's exactly where the orbital retaining ligament lies. And we put a tiny bit of dermal filler in this ligament to strengthen that orbital retaining ligament, but then also to pull the slightly laterally and soften the tear trough area that's developing. And also the skin under the eyes is so thin. The skin of the eyes is 1/3 of the thickness of the skin on the face. And then as we get older, our capillaries, the little blood vessels bringing the nutrition, bringing the blood into the area, start leaking. And then you start getting this, this bluish tinge under the eyes, and the body doesn't mop it up as it used to. It doesn't mop up that that hemoglobin, that blood under the skin, and it leaves what we call these hemosiderin deposits. So we need to do something that's going to chelate, that's going to mop up all these hemosiderin deposits, and that's where our eye peel comes in, because it's got a very high percentage of an acid called thioglycolic acid that mops up hemosiderin, and then it's also got a very high percentage of tranexamic acid that helps for the pigmentation around the eye. So as I say, there are many things that we can do to make the eye area less obvious and to make you less exhausted. And then also you start losing the deep fat pads, especially now, when men are on the GLP-1s, which is great because they're losing weight, but that also affects the skin, and you start getting, you start losing your deep fat pads, and then you start losing the superficial fat pads, and that can also give you, hollowing around the eyes. And that's where we have to replace this volume with a eye projecting dermal filler in a strategic area on the face to give you that little bit of volume back. And we hardly ever do filler here in the tear trough because we know that it can cause problems down the line where you can become puffy. So we give minimal here in the tear trough, but it's all about replacing the volume under the eye that you've lost either with age or that you've lost with your weight loss program. So that's what we do for the eyes. And then you can also use like a dark circle corrector, which has got vitamin K and many other things that can strengthen those capillaries under the eye so that they don't bleed blood. And then we've also got an amazing treatment called a Carboxytherapy, which once injected upregulates all your anti-aging growth factors, and it also increases circulation under the eye by upregulating a growth factor that increases vascularity called VEGF. And just under the eye, so what that does, it not only thickens the collagen under the eye, but it also increases the lymph drainage under the eye and also improves the circulation to the eye and strengthens the whole eye area. And we can do it under the eye and we can also do it above the eye. So that's Carboxytherapy.